Hello, sisters. Welcome to the Sacred Medicine Podcast, weaving powerful, soulful practices into functional medicine. Step into this beautiful space of devotion and explore everything from nurturing foods, rituals, sexuality, and awakening your innate sensuality. It is time to own your radiance. This is the Sacred Medicine Podcast. Hello and welcome back to another week of the Sacred Medicine Podcast. I am your host, Margaret Romero, and today we have Dr. Carrie Jones. She's a graduate from the National University of Natural Medicine. She's a naturopathic physician. She completed 2 years residency in advanced women's health, gynecology, and hormones, and later went on to complete her master's in public health at the Grand Canyon University in Arizona. She is currently the medical director at Precision Analytical. She writes for women's health websites and takes part in podcasts and interviews to promote health education, hormone education to both public and practitioners. So today we are talking all about how to have a healthy vajayjay. So my practice currently is really focused on women's health, which I really, really love. And I wanted to bring Dr. Carrie Jones on the podcast because I wanted to just make sure that we all are clear about how to have a very happy vagina. So we talk about treating yeast, bacterial vaginosis, and naturally what foods to avoid. And so these are really important. These are really simple things that you can do very easily. We talk about our cycles and when to expect possibly some changes and shifts in our flora of our vagina and like what to do about it. Also, how birth control is affecting our vaginal health. Super important. That's a huge topic, and I can literally talk about birth control for a whole entire podcast, but we talk about how it relates to your vagina and your libido. Let's be honest, it totally can deplete and squash the libido in a big way. We also talk a little bit about family planning and what her thoughts are around that. You know, if you wanted to just avoid birth control altogether, some other options. And the one we talked about is about family planning. And, you know, we also talked about different types of pads and tampons, lubrication that you use down there, all the things that need to be totally natural and organic. You don't want to be putting things in the vagina that are not natural. And so we talk, you know, we're both huge proponents of this, and we are just in favor of all organic things. And we also talk about, you know, partners. Do we need to treat your partner if you get recurring yeast infections? You know, does your partner need to be treated as well? So we talk about that. So these are all so interesting and easy things that you can do. You don't necessarily have to see your practitioner every time you have a little yeast infection going on. But if you've got a new partner or if you're practicing unsafe sex and suddenly you have some kind of discharge or funky odor, you definitely need to get checked, you know, for STDs. And so we talk all about that. So it was a super fun interview, and I hope you enjoy it. Now on to the show. This week, we have Dr. Carrie Jones when we are talking all about the vajayjay. Dr. Carrie Jones, thank you so much for being here.
Thank you so much for having me. This is going to be a fun episode. I love it, the vajayjay.
So you're a naturopathic physician, which I love because you look at medicine very similar pretty much as I do. And I love natural approaches to treating common health issues. And I think that women, you know, they come to me very often with recurring yeast infections, bacterial vaginosis. And so I'd love to talk to you today about some of these things and more, just to see how we can keep the vagina happy all throughout the month.
That sounds great. Because who doesn't want a happy vagina? I think we all do.
Yes. So let's start with something as common as yeast infections. What do you do to help women treat that? And is there a time in the cycle when women are seeing this more?
Absolutely. So definitely, obviously, as you know, history is really important. How long have you been getting these yeast infections? Are you prone to them? Do you have a new partner? What kind of, protection you're using when you're having sexual intercourse? Even things like gut health. Tell me about your gut. People don't realize that, the intestines and the vagina and the uterus, like they're all really close together.
Yeah.
So if your gut's a mess, then your vagina might be a mess.
Right.
Time of the cycle, like you said, I have a lot of women that say to me, I feel like my yeast infections come and go. I feel like I get it before my period and then I get my period and it goes away. And why does that happen? I'm like, I know because your hormones change and your pH in your vagina changes. And so one minute you can combat the yeast and then the next minute you can't, but you've never quite addressed the cause.
Yes.
So definitely, right, like really getting to the bottom of all these questions and then going from there.
Yes. So what's the first thing that you tell your patients to do when it comes to reoccurring yeast infections?
So first I test to make sure that it is actually yeast, because as you know, some women think it's yeast, the symptoms are similar, and it turns out it's BV, or maybe even something else, which gonorrhea or chlamydia, which generally are symptomless, but you just never know. So test first.
Right.
And then I'm like, okay, we're going to work on your sexual habits. We're going to work on your dietary habits. We're going to work on your what's going on in your gut. We're going to work on optimizing the pH in your vagina and figuring out why it's dropping or rising so much that it cannot combat the yeast. And starting there, really just especially for women who've had this so much. I mean, just having a one-off yeast infection, like that's that's fairly straightforward and easy. But I feel so bad for women who come in and go, oh, I've been fighting this for years. Oh, I have yeast infections that come and go for years. I'm like, years? Oh, your poor vagina.
Yeah, right. Exactly. And
for sure.
Now, so what are some of the sexual habits that you're seeing with condom use, no condom use?
Both. I definitely see, if you have a new partner, if you, sex, penetration of any kind, no matter if it's with, a penis, a finger, a dildo, it's introducing air into the vagina, and that will change the pH. It could potentially also introduce bacteria, which of course is not yeast related, but you can have a bacterial infection and a yeast infection at the same time. So I'm telling women like, hey, I know it's not sexy, but you have to be careful of hygiene, especially if you're prone to yeast infections. And so, urinating afterwards and making sure fingers and toys and stuff are clean before inserting them. Mm-hmm. Pay attention to lubrications. A lot of women don't realize they're actually sensitive to the lubrication and all the chemicals in the lubrication. If they're not using something maybe a little more natural based, affects their pH. And the pH is the acidic pH of the vagina is what lets you get rid of kill the yeast, right? Like combat infection. And then same with condoms. Obviously, I'm a big proponent of condoms, but yet some women find they're actually allergic to the type of condom that they have, or the spermicide or the lubrication that's on the condom is affecting them. And again, it just goes right back to it changes their pH. Now they've introduced air and chemicals, and poof, they get a yeast infection again.
Yes. Yeah. Yeah. Definitely make sure that your partner's hands are clean. If there's any type of foreplay going on, I mean, super important. You may not even think about that and sort of like in the heat of the moment, but if you can just imagine where the hands have been, opening doors is just like, microorganisms everywhere. And so
everywhere. I had a patient whose husband was a landscaper, and she was getting chronic vaginal infections. And I said, does he scrub his fingernails? She said, what? Why? No, sometimes, depends. I'm like, no. I'm like, you realize he's out in the dirt, in the gardens, in the trees every day. And then you guys have foreplay and all of that is being introduced up into you. And that's not good.
Right. Yes, totally. Okay, so tell us a little bit about gut health and actually nutrition too when it comes to yeast infections.
Absolutely. The research is sort of limited, but I think sugar is a big player for yeast infections. One, sugar is a big thing for yeast in general. You can have yeast on your skin. You can have it, in your intestines. You can have it in your vagina. And so I definitely have patients who say to me, I had a birthday weekend. I ate a lot of really bad. I had cake and all sorts of stuff, and I was more prone to yeast infections. Or after Christmas, the holidays,
right.
I get this uptick, right? In women who go, it was the holidays, it was stressful. I was eating really yummy food, but high sugar foods and high alcohol, and I have a yeast infection. I'm like, I know, we have to. You got to cut that out. You got to cut that back so that you're not, quote unquote, feeding the yeast and just perpetuating the problem. So I always at least start there when it comes to diet. Like, what kind of choices are you making?
Now,
and then go ahead.
Go ahead.
I was going to say, and then when it comes to the gut, it's very similar. Like I said earlier, if somebody says I get a lot of gas and bloating or constipation or diarrhea, if you think about anatomy, the colon and all the intestines, they just sort of right there all around the uterus, and that can really affect vaginal health. And so we see that a lot, right? We see women who they've vaginal yeast infections, and by the way, it turns out they often have large intestine or small intestine issues as well. They just don't realize that they can link together.
Yes, absolutely. Now, let's say it is the holidays, or that it's your birthday weekend and you are away with the girls, and there's going to be consumption of alcohol, you're going to be having cake and all kinds of things. What could a woman do? I mean, should we just start taking in some really good probiotics to kind of avoid this from happening?
That's what I tell them. That's exactly what I tell them. I'm like, I want you to increase your probiotics. And sometimes I will put them on a natural, the antifungal. Like, for example, the supplement berberine, which is a great anti-inflammatory, but it can be an anti-yeast too. And it's relatively safe and it's good for the liver. And so I'll say things like that, like, hey, let's get you on a couple products, oral products, not necessarily vaginal, although there are really great vaginal products, and try to negate this. We know you're going to have a good weekend. Go have a good weekend. Go enjoy Christmas. But let's not get you a yeast infection. Let's be proactive.
Okay, great. Love it. And what about using probiotics vaginally? Inserting them?
Big fan. I recommend it often. Yeah. And there are some companies that specifically have strains. Like there's a strain, it's called Lactobacillus rhamnosus, that has some good vaginal research on it. And so I tell women, look, when you're looking for probiotics, look for the rhamnosus one in particular, and potentially even look for the ones that you can insert as a suppository that has probiotics in it. That could be really super helpful.
Yes. Okay. Great. And
how about boric acid? Do you ever use boric acid with yeast?
I have definitely heard of it. I haven't used it. I actually haven't used it personally, and I actually haven't used it with any of my patients. How does that work?
It works really well, believe it or not. And that boric acid you do use as a vaginal suppository. Please do not take boric acid orally. That'll hurt your stomach and your teeth and everything. But it's perfectly safe in the vagina, and there are natural companies you can get at Whole Foods that or on Amazon that have, vaginal suppositories with some boric acid in it. And man, they can work wonders for women who start to feel a yeast infection coming on, and they can just insert one vaginally and just sort of nip it in the bud. Which is great, beats having to come in to maybe get a prescription or wait to get tested if they're pretty familiar and they know it's a yeast infection, it's not BV or something else.
Right. Now, just from the word acid, I think a lot of women may think that it burns or anything like that, and it doesn't, right?
It does not. And especially a lot of the suppositories are in a mix of like cocoa butter and vitamin E, which are very soothing as well. So it does not burn. Now, I will say if somebody has a very severe raging yeast infection, their labia are very red and cracked. And, sometimes it can come on very quickly, or women let it go on too long because they just can't get in to see their healthcare practitioner, then I would not use boric acid. Go see your practitioner, get tested, and that acid may burn there. But if you're just starting to feel it, you're getting the itchies, and you're starting to have some discharge, and you know it's coming, or you suspect it, but you've had it before, then the boric acid's fine then.
So for women who are in, let's say, a long-term relationship and they are not using condoms, and their partner's sperm, they're reacting to their partner's sperm on a very regular basis, and it's just creating the pH imbalance every single time. Do you have any recommendations for that?
You can still do, probiotics. You can still do them orally and vaginally at the same time. So after you have sex and, clean up, you can insert a vaginal-based probiotic to try to combat that, and then just swallow one, take one orally. And I definitely find and recommend to women, take real probiotics. I know a lot of the commercials on TV say, there's yogurts that are fortified with probiotics, but I want you to take like in the millions or the billions for that matter, versus what's the little bit that's required in yogurt to make it cultured. And obviously a lot of yogurt is fortified with sugar. And you read the side of the label and it's 21 grams of sugar for your little bit of yogurt. And you're like, what the heck? So definitely go for real probiotics.
And are the refrigerated ones, would you say, better than the ones that are on the shelf?
It depends on the company. So generally I say yes if you're just going to the store, and aim for the refrigerated ones. However, with probiotics and technology, it's come a long way. And we've actually found in research that even dead cultures of probiotics can be effective, just in a different way than live cultures can. Okay. Which is very cool. So don't feel that you have to buy the refrigerated if they don't have that available.
Great. Okay, and so the other one is bacterial vaginosis, or BV.
Yeah.
Really common. And I feel that this may be, typically when women get yeast infections, they, aside from all the things that we just talked about, sometimes they'll reach for that monostat. Those are all over the counter. But it's a little harder to get something to treat BV, since there's really essentially not that much over the counter that women can use. It's a prescription. It's metronidazole. What alternatives do you know of?
My favorite one that is DIY at home is hydrogen peroxide. Have you ever used hydrogen peroxide with BV?
No.
You're like, no.
I haven't. No, totally open to it. Yeah.
Right. Plain, just hydrogen peroxide, like you're used to. So you mix, it's 50-50, just water, make sure it's filtered water and hydrogen peroxide. And you basically we call it a gentle vaginal rinse. And so you can, you can use a douche. Don't use this. You just need the applicator, right? The douche part, don't use the actual stuff that you put in a douche. Use that. You just need something to get it up into the vagina to do a nice rinse. Or you can use a big syringe. Just obviously don't put the needle on it. And then just do a gentle vaginal douche. And the hydrogen peroxide shifts the pH. So generally yeast is one way and BV is the other way when it comes to pH. And so it shifts it back down into range. And so, and can really help get rid of the BV and eliminate, the odor and the itching and things that go along with it. But that's my favorite at home that I tell women, if BV is your chronic thing and we know it's BV and you've tested, because like you said, sometimes women get yeast and BV confused, or they can have, weirdly both at the same time. But hydrogen peroxide vaginal rinses can be quite helpful.
How often would you say?
I have them generally do it twice. If it's really bad, twice a day, usually for a couple of days. Sometimes they'll need it for a week straight, and sometimes they'll need it off and on. Like they'll do it for a week. It's the first time they've ever done it, and then they stop and they realize that's not long enough. And so they may have to go longer than that. Sometimes they do it a couple days and poof, it's all gone. It gets better and they feel amazing.
Great. And what about apple cider vinegar?
I do like apple cider vinegar. Yeah, I definitely like it. I use hydrogen peroxide a lot more, only because history, right? It's just what I've used with patients, but I've had a number of patients come in and say, I actually tried apple cider vinegar and it worked wonderful. Like, great. Keep doing it then as you need it.
Mostly for just BV then, right?
Mostly only for BV.
Only
Yeah,
for
that's
BV.
what I just
Okay.
generally what I use it for.
Okay. And if you tend to, let's say she's being tested and it comes back positive for both BV and yeast, would you not use either one of these because it'll only make the yeast worse possibly?
Believe it or not, you can do both. You can do boric acid with BV. I don't find it quite as effective, but it can be effective. And so sometimes I'll say, do the hydrogen peroxide rinse in the morning because it's just a rinse. So you can do it in the shower or, over the toilet, and then insert the boric acid, the little cocoa butter suppository at night before bed. Go to bed, insert it because, of course, suppositories, any kind of cream will leak out at some point and it's kind of messy. So it's better when you're sleeping. And so I just have them do it opposite times of the day.
Oh, okay. Great. Perfect. And then what about, during our cycles, our pH tends to shift. How can women be a little bit more proactive in knowing when things may be shifting and how to sort of help with the change in the pH so something doesn't go awry?
Right. Probiotics is always my number one go-to when it comes to, doing it all cycle long or doing it especially in the second half of the cycle. But I tell women, keep track of your cycle. If you are prone to vaginal things, then you should really start either doing temperature testing every day or doing ovulation predictor kits to see, to see, are you even ovulating? The lack of progesterone, the addition of progesterone can make a huge impact on your pH and on your vaginal health. And so just getting familiar with your cycle and understanding, okay, I get yeast infections, starting on day, 23. Why would that be? Okay, my yeast infections go away when I start my period, or I get my yeast infections at day 14. Is that ovulation? Do I ovulate then? And then you can go forward from there. So tracking can be really helpful and give you some insight.
What's common to see? I mean, I know that it's not good to be having yeast every cycle, of course, or BV, but for the yeast, when would you typically see it? With what sort of hormone changes?
I generally see it leading like PMS time frame. Women will say, as I get PMS, I also feel itchier, or I feel like I have more, like sort of discharge, and that might be yeast. And then I get my period, and it seems to go away. Or it's the reverse. I will have women say, I get my period, and I feel yeasty. Why is that? Why does bleeding make a difference? And blood itself will change the pH as it's flowing through the vagina. But I'd say PMS time is the most common that I hear when the hormones shift right there.
Okay. And so what to do about that though? I mean,
I actually suggest hormone testing, see where you're at, test, don't guess. So see your practitioner, check and see what your estrogen and your progesterone are doing in that sort of PMS time frame, that sort of day 19, 20, 21 time frame. And then see, because if you're really high estrogen, you're very estrogen dominant, then you're going to do something different than if you actually dip down in your estrogen goes a little bit too low. Or if you don't ovulate, I may do something different. If you don't ovulate, you don't make the great hormone progesterone. So we're going to use, nutrients and herbs to try to get your progesterone back. Or sometimes I even use actual real progesterone, which is different than estrogen. So test and find out.
Okay, great. Let's see. I was just about to ask you something about the PMS. And so during period, when a woman has, let's say she's experiencing yeast infection, or she commonly has the yeast infection, almost every cycle during her period, oral probiotics, obviously we're not going to do anything vaginally, and we're not going to be able to do any rinses during that time, right?
Right. It's just kind of a pain. I definitely have women who tough it out and they do it just because they feel like it helps them. But most women say, when I put it, if I use a suppository, no matter what, if I put it up, even Monistat, you put it up and then it comes out all bloody.
Right.
Like, I know. Yeah. So oral probiotics all the way.
Okay, great. All right. And about checking hormones. Let's say a woman is on birth control. How is that affecting vaginal health? I mean, a lot of women are on birth control.
A lot are. And what women don't realize is that the one of the big mechanism of action of the birth control pill is to shut down all the communication from your brain to your ovary so that you don't make an egg, you don't ovulate, you don't kick your egg out. And so you get these really suppressive effects on the birth control pill to prevent you from getting pregnant. And some women will say, well, I'm not even on the pill for pregnancy protection. I'm on it because I have heavy periods or cramps or I have PCOS or, all these other reasons. I'm like, I know, but except it was designed to greatly suppress your own hormones, replace it with these synthetic fake hormones that are kept at a sort of straight level the whole time. And as a result, that loss of your own hormone can affect the tissue in the vagina. Right. And many women will say, I went on the pill and I have vaginal dryness now. I'm like, I know, because you're missing out on your own estrogen production. And estrogen gives you that plump, healthy, juicy vaginal tissue. And then you go to have sex, but you're dry. And now you have an infection just because of micro lacerations and you're just dry. You don't have any lubrication. There's no mucus to protect you. And your pH is off. It's terrible.
And libido drops, and I see that so much. And so women say, I got on the pill because I wanted to be able to have sex whenever I wanted, but now I don't even want to have sex because I have zero libido.
I know. It's so unfair. I know. One of my biggest jokes that I tell people all the time is that when it's my turn, when I'm in charge of the universe, when I'm in charge of the female body, I'm going to make some changes, and that's one of them. Apparently, I have a very long wait. I won't be in charge of the female body for a while, but it's on my to-do list.
What would you do? Tell me what you would do.
That is a big one. I would change the way the reproduction, right? I feel that there's just not very good contraceptive ways for women. Everything is hormonal or an IUD or an ablation or, you have to use condoms. You have to rely on maybe him, or the female condoms are a pain. And so if we could just have a switch, like, no, I don't want to get pregnant today. And you just flip the switch or press a button. That'd be so much easier. Yes. And then the other huge thing I would do for women, which does relate to vaginal health, is I would change the way women go through menopause. I feel like how we got designed for menopause, we hit a certain age and women, they sort of fall apart. They don't want, their vagina dries up, their skin dries up, they're having hot flashes, they're gaining weight, and it's all because they're going through menopause and they're moving into the next phase of life. But I feel like we should be celebrated for moving into the next phase of life. Like, congratulations, you've gotten out of your teens, 20s, and 30s. You've headed into your 40s, and now you're into your 50s, and you've had your kids, and that part's over. So congratulations, no more period. Like, we should get a crown or something, and instead we get vaginal dryness and hot flashes, and that's crap. So
I would love your yes, totally. I would love your thoughts about family planning. Do you recommend this? I mean, if women are like, look, I really don't want to be on the pill. I rather be, they don't want to take that. They want to be able to sort of track things on their own. How successful are women? And is this just like a really huge process that a lot of women just don't have time for?
That's the problem. I think that family planning works really, really well if you are that type A hyper dedicated person, because if you're not paying attention, and then you're pregnant, right? Like you forgot to check one day, or you got your days wrong, or you were busy, or you crossed time zones and now your temperatures are off. And so you're not really paying attention, and then you're pregnant. And we all have stories of friends who, they did the family planning and they have all their kids that way, but they didn't mean to, right? It was an accident. And
right.
They thought they were at the right time and they weren't. And then we have lots of stories of people who say, well, I do natural family planning and I'm not pregnant. It's worked for me. Right. And so I'm a big fan of it. But like I said, I feel women they have to dedicate to that.
Right. There's like a chart, like you need to keep track of your cycle to literally to the degree of
pretty
temperature
much.
And mucus.
Yes.
And all of that. Yeah.
Yep. Because if you don't quite get it right, then you definitely can end up pregnant.
Yes. Okay. Let me see. Yeah. And so what about certain foods that I know we talked a little bit about sugar and trying to avoid that. Are there any other foods that women should be eating that would help like enhance vaginal health?
Yeah, like the fermented foods, like sauerkraut and anything it's fermented, kimchi, even with like apple cider vinegar, it's fermented. It gives you good probiotics for your gut. It's very gut healthy. So anything that's gut healthy, foods high in fiber, things that bind up toxins and move it through, will just always help the vagina in the long run. And so fermented foods, fiber foods, vegetables, all very healthy for the vagina. Even though we're looking at the gut, like it's all related.
Okay, so interesting question here. So you know how there is talk about how men, if they eat pineapple, their semen tastes better, right?
Right.
We've sort of all heard this. Is there a food or something that women can do that allows them to feel a little bit more comfortable with their body odor? Because I know a lot of women are sort of a little self-conscious about it.
That's a great question. Unfortunately, I don't know. I don't know of a specific food. I would hope maybe things like probiotics, which I know we keep falling back on, but if you're, if all your bacteria are happy and healthy, your gut bacteria,
and
your
everything's
vaginal
in
bacteria,
balance, I think things are good.
Yeah, I agree. Then it's your own natural odor, and then it's healthy and normal.
Right. Yeah,
Yep.
And I think that if you do have an odor that most likely it's BV, but you need to get it checked and see your doctor, and don't try to mask it with like these like floral douches, because I think all of these chemicals are just really, they're just not good. They should be staying away from
I would
the
agree.
vagina.
Even things like scented tampons and scented pads and like scented, all of that is just getting absorbed right into your tissue, and you have very sensitive tissue down there, and it's not good for you.
Yes. And if we can just talk a second about using, organic tampons, pads, getting them at Whole Foods, because they're typically not going to be at your local supermarket, then to use, those just the regular type, which are all bleached and they have chemicals in them.
Right. And what women don't realize is they'll say, or, these companies will say, well, yes, there's, they're bleached, so there's some dioxin in it, but it's very little. And women, you may maybe only use these tampons for, 3 to 7 days a month. I'm like, okay, yes, but women started doing this at 13, 14, right. 15, sometimes younger. And some women don't go into menopause until they're in their 50s. So now you have dioxin exposure from, 13 years old up to 50 years old. And that's a lifetime exposure. That's not just 1 month of your life. That's years and years and years and years of dioxin exposure.
And over. Yes.
And I don't think people realize that. And so I totally agree is going for the organic 100% cotton. And even surprisingly, I was in Target the other day, and my Target had, I wish I could remember the brand, but right next to all the, your mainstay normal bleached tampons, they had 100% cotton.
Oh,
this new company that came out in these cute little black boxes. And I was like, well, hey, way to go, Target. So,
oh, great.
You just never know.
And I think also when it comes to lube, I think that's really important to, even like the KY jelly has I think it's got parabens in it.
I believe it does as well. Yeah. Yes. Yep.
So definitely not getting one from there. Like going to, I haven't checked out what Whole Foods carries, if they even carry a natural lubrication.
They do, and the name of the company is escaping me. It's Good something, Good Earth, Good.
Oh wait, Good Feels,
Good Vibes, Good Feels. Yeah, that's what it is.
Right. Okay.
I believe they carry that one. I know women will use vitamin E. I know women will just plain vitamin E. I know women will use coconut oil. They'll have a dedicated Don't mix your cooking coconut oil with your
Exactly.
vaginal coconut oil. But you're right. Women will say, I get these infections, and you say, well, what lube do you use? Oh, I just buy whatever. Oh, my partner just buys, we just get it at the grocery store. Well, if you read the label, I bet you're pretty sensitive to a lot of those things in there. Let's switch you to something else.
Right. Or even like the flavored ones that have like some glucose in it.
Yeah.
Forget it. You'll just get a yeast infection. It's just going to be a mess.
I know, especially around Valentine's Day, right? I mean, I bet you get a huge uptick in patients that come in after Valentine's Day saying, I have an infection. I'm like, I bet you do.
Exactly. Okay. Well, actually, there's a new company called Sustain. Have you heard of it?
I don't think so. No.
I'm actually hoping to have the founder. I think it's the daughter or granddaughter of 7th Generation, and she came out with a company called Sustain, and they have natural lubrication, and I believe condoms as well. Yeah, so I'm hoping to have her on the podcast soon to talk all about that.
That would be fantastic. Man, she'd be a wealth of knowledge for sure.
Yes, absolutely. And I actually want to check out and order some stuff and check it out and see how that works, how that all feels.
Yeah.
Let's see. Now, okay, so was there anything that we missed here?
We covered a lot to make your vajayjay healthy, that's for sure.
Yeah. So
I forgot tight stuff. Do you notice with women,
yes.
Right? Tight pants, tight yoga pants, tight whatever, shorts, causing an issue with, I warn women, I said, some women obviously can wear this and have no issue, right? They're my women listening going, I wear yoga pants all the time. I have no problem. Right. Okay, this is not for you. But for the women who are getting repeat infections, like you may want to loosen it up a little bit, air it out.
Absolutely. Or they're at the gym, they have a good sweat, and then they go and they run around and do errands for a couple of hours.
Yes. Don't do that. You need to go hygiene. Take off the sweaty clothes. Take a shower. Clean up.
Shower at the gym, possibly. Mm-hmm. That would be a great option. Mm-hmm. Yes, definitely. And then what about, I love if women are having vaginal issues, I just say, don't even wear panties at bed.
Agreed. Same. I tell them the same thing. Yep. And you don't have to wear anything. You can go to bed naked, or if that bothers you, wear pajama bottoms, wear little pajamas, but don't wear underwear. Let your vagina breathe and air out a little bit, and it'll be much happier.
You know what? That just brought up another question. What about a woman who's had recurrent yeast, and then what about her partner? I mean, because they could be swapping it back and forth. What are your thoughts around that?
Yes. I feel like we hear this a lot, don't we? Absolutely. I think men should be addressed as well. So I will either see the, I guess it could be male or female partner. I will address them both. I will say you both need to be on, some sort of probiotics. You both need to be aware of your hygiene. If she's getting tested, just if he's a new partner, like he needs to be tested for things. Men aren't tested for yeast or BV, but they are definitely tested for sexually transmitted infections. So making sure you know what you're up against. And then men who can have, and female partners, the other partner, gut issues. If they have a lot of gut issues, it's definitely going to affect their genital urinary tract, which can then be, swapped out
That's
to
true.
the partner, to the affected female, right? They're making out and they're having foreplay and they're having sex and they're exchanging fluids in some degree. And all of a sudden, they're just flipping it back and forth. So treat the partner. Go remind your partner that they need to get treated as well.
Also, if the guy has any form of thrush and he's performing oral sex on her, I think that there's a huge risk of transmission there.
Yes, absolutely. Absolutely.
Yeah. And so I've seen, I don't know if you see a lot of this, but I've seen a lot of men who have candida on the tip of their penis that need to be treated. And it's from transmission. They'll get those little red, kind of like little blotches on the tip of their penis. Have you seen that?
I have. I don't see as many men in my practice, but yes, I have had that.
So I typically
treat them.
Yeah, I treat them, and And they almost always will say, well, my girlfriend or my wife has had a yeast infection, or she was just at her GYN, she was having some kind of issue. And then they come in scared that it's an STD, and then we do all the testing. But it has a certain particular look to it when it's candida at the tip of the penis. And it doesn't hurt. It typically doesn't even itch, but it's pretty red, and it's usually just at the tip from what I've seen over and over again. So I'll put them on. Sometimes I'll put them on some diflucan and probiotics. Yeah.
Yep,
but I also
same.
talk to them about their diet as well, decreasing the sugar.
Yep.
And this is an interesting question that I thought of the other day. Do you think that men who have somewhat of an uncontrolled type 2 diabetes have glucose in their semen?
It's possible.
I've never tested. Obviously, I've never tested. Obviously, a man's semen to see if there was sugar in it. But I'm curious, like if they don't have a controlled glucose and their partner keeps getting.
Yeah, the glucose is just spilling out everywhere.
I mean, it has
right?
to spill out.
It spills in the urine.
It spills into the urine,
yeah.
Exactly.
So it could definitely spill out into the semen. I'd have to check that mechanism of action, but we know people who have uncontrolled type 2 diabetes have more yeast issues, right? They tend to get it on their skin and in their intestines, and in women or with uncontrolled type 2 diabetes are more prone to it vaginally as well. And so, yeah, that's a great thought.
Yeah. I was just wondering if you had seen that clinically or I
had not, but now I'm going to be on the lookout for it.
Okay, this was such a great conversation. I think we touched upon everything to make the vagina happy. I think this is great. How can people find you? Tell us a little bit about what you're kind of up to right now.
Yeah, absolutely. So I am right now I'm actually the medical director of a hormone lab company called Precision Analytical. We are the creators of what's called the Dutch test, which people say, oh, like you test for Dutch ancestry. I'm like, no, it's actually an acronym. It's a dried urine test for comprehensive hormones. So you can find me at dutchtest.com, DUTCH test.com. And we do a lot of hormone education. Not so much vaginal, although obviously it's very, very tied, but for women who are just experiencing a lot of hormone issues, men too, we provide that. So we do the test, and then we provide tons of videos and blogs and, social media content to try to educate you about your estrogen, your testosterone, your progesterone, your cortisol, and then how it's all related.
And people can only order this test through their practitioner?
No, they can order it to them online as well. So if you have a practitioner, you can absolutely go to your practitioner and see if they'll order it for you, or you go right to dutchtest.com. There's a little drop down, order a test, and you can order it on your own and then learn about your hormones on your own.
Oh, great.
Yeah.
Perfect. And let's see, are you also you're on Instagram? I know I follow you on there.
Yep, I am on Instagram, which is it's dr.Carrie Jones. So dr.Carrie Jones. And then the company is at Dutch Test. So you can follow us both, and we give lots of great information on hormone health.
Great.
Yeah.
All right. Well, thank you so much. This has been such a fun conversation. I love talking about this stuff, and love meeting, practitioners who are all like-minded, and I know you're all the way on the West Coast. So thank you so much for taking the time today to share your wisdom with my audience. And yeah, I think we've got a lot of women who are super interested in, trying approaches that are more natural rather than having to go to the doctor every time. Obviously, if I just took antibiotics and now I have yeast infection, then that's pretty straightforward, and most likely you can try some of these. But if you don't know if the infection's coming from you're not really sure where, or if you have a new sexual partner or you've just started to have unprotected sex, it may be a good idea to just get tested for everything and just make sure that we're not talking about an STD, gonorrhea, chlamydia, and so on. So
definitely better to be safe than sorry.
Yes, absolutely. Well, thank you so much. And I so appreciate that you took the time today.
Oh, thank you so much. This was a lot of fun. Favorite topic of mine.
All right. Have a great day. Well, I hope you totally enjoyed this conversation. So much fun. And here's to having a really super healthy and beautiful vagina. And personally, I love the word pussy, so that's kind of where I'm going with that. To learn more about Dr. Jones, for all the show notes, head on over to margaretromero.com/episode 64. And I will see you all next week. Also, check me out on Instagram. I am there under Margaret Romero. If you haven't, check out my new website at margaretromero.com. I am coming up with some new offerings. If you are in the local area in New York City or in the tri-state area, I will be hosting monthly workshops. Really exciting stuff coming up in February. So I will all let you know all about that. Have a beautiful rest of your week. Much love. Big hugs. Thank you so much for listening. Take care. Bye for now.